significant impact on so many of them. Dr. George James, licensed marriage and family therapist for the Council for Relationships, joins us now. Doctor, appreciate you joining us this morning. And I do want to start with this new CDC study on poor mental health among teenagers. What sort of thing counts as an adverse event? And how has this impacted the mental health crisis that we're facing?
Good morning. As we've seen with a lot of our young folks, including our teenagers, they have gone through a lot. And so if we look at what the pandemic has done, where they've probably lost people they've loved, or the thought of dying, also just the thought of racial injustice and the intensity of that, also just isolation and not being able to be around their friends or be social. These things that have just been negative, disruption from school, these things would probably be considered under adverse effects that have been hard and overwhelming for many of our young people, which has increased their negative mental health.
Let's switch to another study, a new one, which talks about something simple that could actually benefit kids. We're talking about time spent in so-called blue spaces. So tell us, what are those and what should we know about them?
Yeah, when we think about blue spaces, it's really when we think about lakes and the ocean and the water. I mean, just think about even being a young kid and wanting to go to the pool. I mean, there's just things about being in these spaces that allows us to feel peaceful, feel serenity, feel positive, and it actually impacts our mental health in a really great way. So that's why we've seen an increase in going to natural parks, national parks. We've seen people going to places where they can see water or be near water. And so that is an encouragement to do that to help you in your overall mental health.
Nothing like a good walk in nature. Doc, I'm curious, as many of us are watching gruesome true crime shows such as Netflix's Dahmer, and we know that horror movie season well underway leading up to Halloween. I want to ask you, why are some of us drawn to these kind of gory films? And most importantly, is it even good for our mental health to watch them?
I think that is probably dependent on each individual person. But I think a lot of people are drawn to it because it's entertaining, one, and two, I think that it can feel like an escape. It's a thing where you are not thinking about whatever else is going on in your life at that moment, and that can actually feel really great for you in those spaces. But for some people, it can actually trigger more anxiety and more panic in their life. And so you got to be really careful of when you see those things, when you go to those movies, when you see those stories. Does it stay with you? Does it haunt you even? And if so, maybe that's not the best thing for you. But if you have a good time, a good laugh, and you move on, then maybe it's a great escape and it might help you overall.
I was going to ask, does it help if you watch like this? Then does that make it better?
That's always the best way to watch.
All right, okay. Trust your gut. I love it. Well, Dr. George James, thanks so much. And if you or anyone you know is still struggling, you can call or text the Suicide and Crisis Hotline. That number is 988.
Coming up, a new place to post